Kate, thank you so much for taking some time while we're here at the Digital Health and AI Innovation Summit in Boston. And since we have some time, we decided to go outside, and it's beautiful to be here in front of MIT in nature in a way, which is a perfect setting to talk about mental health. You're a mental health specialist by background. In the past, for over 10 years, you worked within colleges to take care of the needs related to mental health. You're now working with a company that's providing a digital help for mental health for younger generations. So let's start off with a very broad question around what are you observing in terms of the impact that digital interventions can have on mental health, given the rising challenge that mental health is?
Yeah, so it's interesting because it's there are some mixed concerns, but what I will say, the benefit in terms of what digital health has been able to support is really the equity in the access for different students. So if you have a student out in a rural community, perhaps there aren't enough providers out there. And so telehealth has given them the opportunity to connect with a counselor and maybe connect with a counselor who might have a specialist in something that that they need that's not available locally for them. So there's that piece. There's also the piece around the fear for a student to, because it's college mental health typically that I've worked with, the fear of a student going into a college counseling center and being seen, or that embodied experience being too intimidating for somebody at their first try at a mental health intervention, which is really a big piece of how this company was started. The founder and CEO of my company, Coady Semrau, was a college student who was fearful about seeking counseling for identity issue he was having, and he just didn't feel comfortable going to the college counseling center for a long time until it became desperate. And so he started this company to support students like him that really just need another option for access to care.
Mm-hmm. So in essence, what I hear you saying is that the stigma around seeking help for mental health is still quite big. And I actually want to reflect on that a little bit.
Mm-hmm.
So when you were working, still in colleges, in 10 years, what kind of changes did you observe in terms of the needs of students, the access that they had to mental health support, and also their own attitude towards seeking that help?
Yeah, so there's a couple of stories here, a couple of narratives that I think are relevant. One, we've done a really good job destigmatizing. So we definitely have more people who are help seeking than ever before, which is a positive thing. It's not for the vast majority, I think, at least a critical mass of students, it's not as intimidating to go as it used to be. That said, there are still, we see enough persist in terms of some of the ills of our society, and that people really do fear the repercussions or aren't ready to address something with somebody that feels so intimate. And so, there's this piece that telehealth can kind of support. But beyond that, we also do continue to have students who we've made college access a lot more equitable than it used to be. So you have students that are coming to college with different challenges than the students before them. And partially it's because we've worked to make sure that college in the US is more accessible to students who are underprivileged and who are underrepresented in a lot of different ways. And the supports haven't caught up on college campuses to support those students. So we're recruiting you, we want you here, but we don't have some of the things that are going to specifically support you. So then students are interfacing with being, maybe they're at a predominantly white institution and they are a black or brown student and are feeling like a major fish out of water situation and feeling marginalized and discriminated against, or whatever might be going on for them. A lot of those students, although it's not mental illness, the disruption that it impacts them with causes them to go seek support and counseling.
one of the topics that's raised very often in correlation between mental health and teens or students is the use of smartphones, the use of social media. So from that perspective, what were your observations in that sense? Especially in the US, there's a big debate going on campuses and schools prohibiting the use of mobile phones during school, with different successes, with different measures. What are your experiences in that regard?
Yeah, I do think that we've seen, as if there weren't enough evidence otherwise, we've seen enough anecdotal evidence to suggest that these little computers in our pockets, in some ways, these little slot machines in our pockets are getting between us and interpersonal relationships. And so people have experienced, for many reasons, of course, but more of a loss of community, more of a sense of affinity for each other and attachment to each other, meaning that they get kind of sucked in and use the phone for additional comfort. You know, they keep looking for those little hits of dopamine. They can't tolerate being bored. And, you know, I certainly don't want to globalize this to everybody, but we do know that we are seeing this at kind of a critical mass in terms of the impact on students.
Mm-hmm. Before we had this discussion, you mentioned that when you were still working in a college, that you also had some prohibitions in terms of the use of mobile phones. Can you talk a little bit about that? How did the school decide to not ban phones but limit their use? And how did that whole process look like? Because this is still a polarizing issue. You know, there's mass shootings going on. Parents want to get access to their kids at any moment. At the same time, you know, like when it comes to bullying, some people say that, you know, then if bullying happens, it's recorded, so you have evidence which helps with potential prosecutions or conflict resolution. So how did the situation look like in your specific institution, and what was the impact after that ban was implemented?
So actually, it wasn't at my institution, it was in my children's high school. So they are in their second year of a phone ban, and the administration and the teachers are reporting it's making a significant difference. And what I will say is that...
What kind of difference?
That it's really, the students are talking more in the hallways, they are more engaged in the classroom, and they are, I mean, I think they're a little bit more present. You know, they're not escaped into their devices. Certainly, you know, bullying persists and some of those things, but I don't think that it's, I mean, I think they're experiencing some reprieve from it at this point, just being able to teach again and not have everyone completely disengaged from the experience of being in high school together. Even in the cafeteria, you know, kids talking again is pretty critical, and being able to kind of have some of those normative experiences in interpersonal relationships.
A social psychologist, Jonathan Haidt, recently published a book called The Anxious Generation that talks about the impact of social media on teens, especially, for example, young girls are very affected by looking at, you know, beauty standards that they see on social media, specifically Instagram. One thing that's very interesting that he mentions is that some sort of echo that happens in the population when, for example, one person is feeling depressed, and that kind of spreads, like when you're yawning and everybody else starts to do that. It's not a direct comparison, but there is an impact on that, and also an impact of actual patients reporting on their mental health or physical illnesses, and then others identifying with that and seeking care. So there's a lot of things that are overlapping that. So his suggestion, and not just his, many psychologists kind of advise that the limit for smartphones should be 14 years old and social media 16 years old. So what I'm wondering here is, how do you see these kinds of recommendations and the relationship between digital interventions and what can benefit mental health? Like, why would digital interventions help if they're a cause of the problem? So how can they be a cause and help at the same time?
The reality is that these things are designed to keep you engaged. And so the digital applications that these kids are engaged with are, the sole purpose is to keep their eyeballs on it as frequently as possible, because that's what you monetize essentially. And so I think when it comes to digital intervention for mental health related concerns, really being able to have applications that are kind of minimal and sufficient. So the idea is that yes, we do understand that there are benefits. We understand that the benefits of teletherapy as compared to in-person therapy are pretty equivalent. And so, the pandemic gave us the opportunity to learn more about that. But it doesn't mean that somebody needs to spend more time in the application that they're connecting to their therapist through, or constantly using some sort of well-being application on their phone. The idea is get in, get out, get the need met, and get back out, and not continue to really kind of exploit the what we understand is happening with what keeps kids engaged in these types of apps.
Technology is always changing society. So what I'm trying to be also mindful of when I'm thinking about, what's good and what's bad is that younger generations think differently than we think. They were brought up in a different world that we were. So to which extent, our interventions that are trying to move children back to only the real world, if I call it like that, realistic, and to which extent do we need to somehow find the middle way where we teach kids how to use technology responsibly? I mean, are they even in a developmental stage that they're capable of that? As a mental health specialist, I'm assuming that you can talk a little bit about that.
A little bit. It's not my area of specialty, but what I will say is that yes, we do know that we're seeing a delayed development of the prefrontal cortex. And so, I know that there had been actually, and I think in Jonathan Haidt's work, he does reference the Japanese study, and I had heard it come up somewhere else, that when they did, I think, functional MRIs of young men, that they were finding that prefrontal cortex that they used to identify as being maybe fully developed by about 21 is now looking more like 25 or a little bit later, and then they're starting to see the trend affect young girls the same way. And so, the brain development is actually further delayed, and I think a lot of that does have to do with how our society has treated safety and parenting these days. So there's probably a mix of causes for it, but this idea that you don't necessarily have the capacity to make conscious decisions that are more focused on longer term impacts. You're in the immediate, you're experiencing for the moment, you're seeking that little dopamine hit. You don't really have the capacity to pump those brakes and understand that you might not want to make that decision of picking up your phone every time you feel bored.
Mm-hmm. Where do you see that most successful interventions are when it comes to improving mental health, given your work in this space? So, for example, at the conference, we also saw ideas about creating biomarkers where you could detect depression through just a very short discussion through voice biomarkers. But at the same time, we already have, PHQ and GAD criteria that help clinicians identify when patients are depressed, and just medicalizing people with depression is not enough. It has to be coupled with therapy, with other interventions. I guess this is also where DTX comes in, meditation and all the other interventions. But what I'm thinking is, how do we make sure that we are making the best use of all the tools that we have, and not just exacerbating the problem by just over treating people and giving them proper support?
So I will say, I think one of the things that I like is being able to focus, certainly at a population level, on attending to the loneliness and the disconnection and the loss of community. I think that is one thing that certainly people are attending to, but we don't yet know how to make meaningful use of technology to support some of that, because the goal is you're not using technology, in fact. And actually, I can't recall what it was, but there was someone who had worked on something that was really about supporting meetups. And I wish I could remember what it was. But you know what it is?
Pals is one of the organizations that's
Okay.
trying to connect people to be companions for just
Okay.
different generational populations.
Yeah.
And I actually had a discussion about that last year, and what was really interesting to me was that, especially in the elderly population, where loneliness is especially a problematic theme, in US culture, people really value their independence. So you might think, it would be great to create this whole community in the elderly population, put them together in one house so they can, have a blast. But actually, they don't really want that. So this is also another problem that we have between how is society changing towards individualism and not, it's just difficult to adapt to something different that theoretically speaking, we know is better.
Well, I think there's a piece too with just because, so, we are talking about psychotherapy, we are talking about medicine, we are talking about things that have some ethical responsibilities. And this idea that just because someone will do it, or just because somebody likes it, doesn't necessarily mean there's any efficacy associated with it. So, thinking about some of the apps that are out there that our digital native youth are interested in, that they believe is supporting their well-being. A lot of times we're seeing that it's not, in fact, supporting their well-being. It's, in fact, just supporting them being on their phone more often. I think that there are plenty of ethical and thoughtful entrepreneurs out there, and chief medical officers or whomever they are, that are really trying to focus on where are their gaps. So I know some of the speakers that we heard from today really talked about the gaps. Who are we missing? Who are we not seeing? And how do we attend to bridging that gap through technology? That stuff I really applaud. I think it's a really incredibly important to be able to identify that. But to your point, we do have, just because we can do something doesn't necessarily mean we should, and doesn't necessarily mean it helps.
Yeah.
So, I think there's a big rub there.
To make some sense out of everything that we discussed, because we really unveiled and pointed out to many challenges, based on the experience with over 150 colleges that the company that you currently work for is working with, what are some of the good practices or good trends that you see that are contributing to improved mental health with technology?
Yeah, so certainly, again, we are seeing students who are seeking support that they just might have gaps to access in their communities. It may be that, one of the big things that a lot of colleges will use us for is for connecting students. They have a very homogenous group of therapists, whether it's based on professional discipline or therapeutic specialty or identities, racial identity or gender. And so we have the opportunity for students to be more likely to buy in to working with somebody because we have the ability to recruit more diverse therapists. So part of it is just going to be about identity and students' perception about who's going to be able to support them. That's just a reality. But the other piece too is really being able to give students the opportunity to connect with someone. Therapy needs to be more than that. That there's an ethical responsibility to have a treatment goal and look to ameliorate symptoms of an issue, that type of thing. But at the same time, we know loneliness is a root cause of a lot of disruption to people. And so just being able to take that first step at making that connection, I think, has made a big difference for a lot. a lot of students.
Kate, thank you so much for the insights that you shared, for taking the time and taking, the time to actually walk here, to do this here. And now I think it's time for us to get back. It's also getting a little bit cold, so we can conclude the discussion. And thank you.
Thank you.